Good morning, everyone. I am Dr. M. Gouri Devi. I am the director of Ridge IVF and Gauri Hospitals Limited, and I am also the director and senior consultant at Fortis Ridge IVF, Shalimar Bagh. This is 25th July was the World IVF Day. Why is it called World IVF Day? 1978, Louis Brown was born in England as the first test tube baby. After that, that day is being celebrated as the World IVF Day. Having said that, now, is it a very common procedure? Globally, over the world, 8 million babies have been born by some or the other form of assisted reproductive technologies. In India, we are far behind. Our number of cycles are not much. Maybe because, number one, there is no reach for the patient to get into to get into the centers which do IVF. Number two, awareness is not there. There is a sort of a stigma that IVF is painful, IVF is a long procedure, IVF is expensive, and this sort of a stigma still persists in Indian population. Now, I would like to give in short what is IVF? IVF means we are taking a sperm from the husband, egg from the wife, and it is fertilized outside the body. It is fertilized in the incubator. We have to inject one sperm into the ovum many a time. That procedure is called ICSI. And once the embryo is formed, either on the third day or on the fifth day. Why the third day? Third day is the day when you have the 8 cell stage. That is the early cleavage transfer, what we call. और उसके बाद फिफ्थ डे ब्लास्टोसिस्ट ट्रांसफर करते हैं and we shift it to the display, we replace it into the uterus. In short, that is IVF. Now, coming to this thing, when do we need it? Do all patients need it? No. When there are blocked tubes which cannot be opened, sometimes we do not know the reason. Everything is normal. Patient is not conceiving. It has been 6 years, 8 years. They have been trying different methods. This is useful. Some cases of PCO, there, there is a swelling called endometriosis. This is many women in India and abroad suffer from it in these patients. So these are some of the indications where we use IVF. Now, what is it? What does it involve basically? Let us get it very clear. Number one, we have to stimulate the ovaries so that we can get the eggs. That involves giving them what we call as gonadotropins. Injections are given. It is to be taken every day for about 10 days. Along with this, we also give something known as agonist or antagonist along with it so that premature ovulation does not occur. And then once the eggs are ready, we give an injection for trigger. Trigger is to make the ova ripe for pickup. Once we give the trigger, after about 34 to 36 hours, we do the pickup. What is pickup? We retrieve these oocytes. This is all done under ultrasound guidance, and generally an anesthesia is given so that patient doesn't feel any pain. And once the eggs are retrieved, these are taken in the lab. The embryologist, she chooses whether she should go just put the semen sample with the sperms with the egg in this thing, or whether she should go for a ICSI, where you are injecting a sperm into the ovum. That is the so what we have now is an egg retrieval and a sperm retrieval. We have to get the sperms to inject, and once that is done, we put them in the incubators. Then we wait for it to mature, and either on the third day or on the fifth day. Many a time these days, blastocyst, that is the fifth day transfer, is said to be better because the implantation rate is better, pregnancy rate is better. But mind you, we should have enough embryos to take them to fifth day, because if you have 5 or 7 embryos, if you have, 2 or 3 will go to a blastocyst. Suppose you have only 2 or 3 embryo, I wouldn't take that risk. Better to do a day 3 transfer, at least she gets a chance. So once we do the transfer, we wait for about 14 days. Anything from 12 to 14 days, we do a blood test which will determine whether she is pregnant or not pregnant. So, in short, this is what is IVF, or it is also in layman's tongue, it is also known as test tube baby. And when we transfer the embryo, it could be that we are transferring fresh, like this cycle she had a pickup, we have fertilized it, and the same cycle we are transferring it. That is a fresh cycle. Many a time, like polycystic ovarian, you have a number of embryos, patient can go into a hyperstimulation. So what we do is we freeze these embryos and transfer them in a next cycle, wherein patient's uterus is prepared for with the hormones for implantation, and then the embryo is transferred. Frozen, like I said, blastocyst has a better chance of implantation. It is found that frozen embryo transfer, the success rate is more. So, because of which the patients as well as the clinicians feel that we should use a blastocyst transfer and a frozen embryo transfer. So, that this is what the essential thing is involved. Involved in IVF. Whenever there is a problem, suppose the woman is devoid of eggs, there is no way she can get an egg, and men is totally azoospermic, no way we can get a sperm from that man. There are banks available from wherein we can get oocyte as well as sperm donation, and that is used for the conception. These facilities also available, and surrogate can be used if the woman is not capable of producing. Like the woman has no uterus, how will she produce? Or woman's uterus and tubes are totally destroyed by a disease. She cannot produce. So in such cases, surrogacy may be an option to produce a child. India has come up with very good rules and regulation, ART rules and regulations, surrogacy regulation. So temporarily, surrogacy is at a hold in India for time being. Once the rules are set, things will be smooth and surrogacy will be possible. Now, this is in short about IVF. Now let me see what questions you're going to ask me regarding this. You are most open to ask me questions on this. Now, there is a question, do the IVF babies look like their parents? Generally, if both the sperm is from the husband, the ovum is from the mother, the children, like in any normal pregnancy also, it is not necessary that the child should look like their parents. So the same chance is there here also. The gene pool is the same. Whereas if you are changing the gene pool by taking, अगर आप sperm या oocyte egg किसी और लेडी से लेते हो, then ये चांस रहता है कि कुछ चेंजेस हो लुकिंग अलाइक में. जनरली हम लोगों को सबको इंडियन टाइप ऑफ फेसेस है, तो खास फर्क नहीं पड़ता. Okay. It is an interesting question that when should someone go for IVF and when should someone go for IUI? जब थोड़ा सा स्पर्म ओलिगोस्पर्मिया कहते हैं, सेमेन में थोड़ा कमी है लेकिन ग्रॉस नहीं है, थोड़ा सा कमी है, या अनएक्सप्लेन्ड इनफर्टिलिटी कहते हैं, कोई रीजन नजर नहीं आ रहा, या सर्वाइकल फैक्टर दैट इज यूट्रस का माउथ में जो म्यूकस होती है वो कई दफा हॉस्टिलिटी होती है स्पर्म के लिए. इसमें इन केसेस में आईयूआई करने से चांस ज्यादा होता है. ट्राई कर सकते हो क्योंकि आईयूआई चीपर प्रोसीजर है और बहुत कॉम्प्लिकेटेड लेबोरेटरी वगैरह की जरूरत नहीं है, आराम से हो सकती है. सो आईयूआई कैन बी डन. अगर समझो कई साइकिल्स ऑफ दवाई ले चुके हैं, 3 साइकिल्स ऑफ आईयूआई भी फेल हो चुका है, दैट इज व्हेन आप आईवीएफ में जाना चाहिए। और इसमें एक और खास बात क्या है, यंगर एज में करो, दैट इज बेटर। 40 साल का उम्र में, 42 साल का उम्र में जाए, खुद का एक से बच्चा होना डिफिकल्ट हो जाता है। इंडिया में 38 ईयर्स के बाद खुद का एग्स लेडीज में बहुत कम हो जाते हैं। हाँ, कुछ लेडीज है जिसको अच्छा है, बट जनरली कम हो जाती है। Now, how many injection do we need for an IVF? Okay, there are अलग अलग प्रोटोकॉल्स होती है आईवीएफ में स्टिमुलेशन करने का। एक टाइप का स्टिमुलेशन होती है जिसमें हमें जो मेंस्ट्रुअल साइकिल डे 1 होती है उसका 7 डेज पहले से एक इंजेक्शन शुरू होती है, फिर डे 3 से 10 डेज और एक इंजेक्शन ऐड हो जाता है। सो दैट मेनी इंजेक्शंस आर देयर। उसके बाद एक दफा ट्रांसफर हो जाए, उसके बाद ट्रांसफर के बाद इंजेक्शन देना है या वेजेनल पेसरीज देना है, ये आपका डॉक्टर सजेस्ट करेंगे। कुछ लोग इंजेक्शन प्रेफर करते हैं क्योंकि ल्यूटियल सपोर्ट उससे अच्छा हो जाता है। तो मेंटली द लेडी शुड बी रेडी टू हैव इंजेक्शंस फॉर अबाउट अ मंथ, जिसमें ज्यादा जो है पिकअप के पहले 10 डेज होती है, उसके बाद एक सिंपल इंजेक्शन फॉर अनदर 15 डेज। नाउ एक क्वेश्चन है कि कैन आईवीएफ वर्क फॉर द फर्स्ट टाइम? It is the patient's luck. Generally, first cycle conception, वो भी fresh transfer करें, is about 35 to 40%. Younger patients में, mind you, that is the first time. Yes, it can work at the first time, but generally you might need 1 or 2 more transfers. This is an interesting question. How long does IVF take to get pregnant? Okay, let me tell you. It all depends on the patient's age. Statistics पे देख के जाए, मैं आपको बता दूं, इंडियन डाटा इतना अभी एक्सटेंसिव नहीं है। गवर्नमेंट आफ्टर दिस रूल्स एंड रेगुलेशंस एक सेंट्रल बॉडी बना रहे हैं जिससे पूरा डाटा आ जाए। अभी तक रूल्स एंड लॉस का गैम्बिट में नहीं था, तो हम लोगों का एक सेंट्रल रजिस्ट्री नहीं है। एक नारी करके रजिस्ट्री शुरू हुआ था, बट उसका कंप्लीट वो नहीं है। तो मैं यूरोपियन डाटा में बता दूं, उन्होंने फ्रेश और फ्रोजन ऑल एम्ब्रियो ट्रांसफर लेके उनका कहना ये है कि about 2/3 of the patient conceive at the end of it. That is about 66% of them. Now, कितना साइकिल्स की जरूरत पड़ेगी to get this 65.3%? This is the latest data मैं बता रही हूँ. This came in 3rd February 22. 5 to 6 fresh or frozen cycle. Like एक पिकअप करा, आपके पास 6 एम्ब्रियो है और आपने एक दफा डाला, then you have tried for 2 more. Like that, fresh and frozen मिला के 5 to 6 cycle total हो जाए, you get a 65% success rate. This is the world data. और एक और डाटा था, this is from the Victorian Association of Reproductive Authority, what is known as VITA. They said less than 30%. In the first cycle it is 43, second cycle it is 59, third cycle it is 66%. Between 30, 35, 40, 54 and 61%. But 40 से ज्यादा हो जाए, 40 साल उम्र में से ज्यादा हो, तो फर्स्ट साइकिल में 13%, सेकेंड में 21 एंड थर्ड में 25. So it's all about the age. Now, how do women prepare their body for IVF? Basically, what to do is they should have, if they are obese, they should try to do exercises, do a bit of a dieting, try to get a BMI under control. दैट इज मोटापा कम करना चाहिए, क्योंकि इंजेक्शन दो देते हैं यूनिट्स पर केजी बॉडी वेट है, तो बहुत ज्यादा वजन हो तो इंजेक्शन का मात्रा बढ़ जाता है। लाइक एक थिन इंडिविजुअल 50 किलो की औरत को हम 150 या 225 यूनिट्स देते हैं, तो बहुत मोटे हो हमें 450 तक देना पड़ सकता है। उससे कॉस्ट भी बढ़ जाता है, इफेक्टिवनेस भी कम हो जाते हैं बिकॉज ऑफ द वेट। सो ओबिसिटी शुड बी अंडर कंट्रोल. They should have a balanced healthy diet. Even normal individuals, they should have a balanced healthy diet. Stop smoking alcohol and any of the recreational drugs. They should not take any of them. As I told you before, maintain a healthy weight, and I always give them some form of multivitamin, which also includes folic acid. And exercises, light exercises, definitely helps because there are endorphins generated in exercises, like a good walk in the morning, and that gives her a positive feeling. So these are the general thing to prepare for IVF. Now, how many rounds of IVF does it take to get pregnant? I already told you. Total generally in about 3, but to get a 65% success rate, at least 5 to 6 cycles. Mind you, they are not fresh. It's not that in all the 5 to 6 you are getting injections. No. In 5 to 6, which includes fresh and frozen, you get about 66%, 65.3% success rate. Okay, why are some people advise progesterone injection till 7 months? Generally, ये 7 months तक नहीं देते. Usually क्या होता है, 3 months तक देके placenta, what we call as luteoplacental shift और प्लेसेंटा फॉर्मेशन बनने के बाद प्लेसेंटा का ओन प्रोजेस्ट्रॉन अगर शुरू हो जाए, फिर प्रोजेस्ट्रॉन की जरूरत नहीं है. लेकिन कुछ पेशेंट जिसको रिकरेंट अबॉर्शन का हिस्ट्री हो या बार बार उसको पेन हो जाती है और डर लगता है कि प्रीमेच्योर ना हो जाए, इन केसेस में हम लोग उसको कंटिन्यू करके बेबी वायबिलिटी हो जाए, because 28 to 30 weeks is said to be the viable rate in India. So 28 weeks to 30 weeks हो जाए, then you can stop progesterone. Having said that, कुछ लोग 32 weeks तक भी ले जाते हैं. Yeah, frozen embryo. Yet the question is fresh, freeze embryo, frozen embryo transfer better than fresh? It is said that this transfer is more successful. It is very correct, because more successful means pregnancy implantation rate is better with frozen embryo compared to that of a fresh embryo transfer. That is why generally in the world people have shifted to frozen embryo transfer. Surrogacy, I will not say it is banned in India. Government has put good restrictions in the sense. Number one, that it should be somebody close to the family. Initially, they said it should be a close relative. Now that they have removed the term relative, they said close to the family it should be, and it should be altruistic. It is not a commercial surrogacy. Commercial surrogacy is banned in India. You should have it should be an altruistic thing. And then they have put this thing that the commissioning couple should approach they are going to have a central body wherein there will be a magistrate, subdivisional, and they will have to go to the magistrate, get it approved that this woman is not capable of undergoing a pregnancy, hence she requires a surrogate, and she will identify the surrogate, and with that permission she can go to any center, get a surrogacy done. But at the moment we are at a standstill because the central bodies in each state is to be formed. Now, is IVF a painful process? Okay, this is इसका दो व्यू है. एक तो ये है फिजिकल पेन। फिजिकल पेन में क्या है, इंजेक्शंस लगाते हैं तो इंजेक्शन का पेन जितना होता है वो होती है। कुछ लोगों को थोड़ा सा वो लोकल एरिया में रेडनेस होती है, थोड़ा सा कंफ्यूजन टाइप का होता है, और शी माइट फील लिटिल इरिटेशन देयर, एंड जनरली इट इज अ सब्जेक्टिव थिंग। एक लेडी को पेन ही नहीं होता, दूसरी लेडी बोलते बहुत पेनफुल है, सो इट्स अ सब्जेक्टिव थिंग। बट इंजेक्शन का पेन जो है ही। बट देर इज समथिंग कॉल्ड मेंटल एगनी। मेंटल, like she undergoes all that, सब कुछ ओके, एम्ब्रियो ट्रांसफर भी हो गया और उसके बाद फेल हो गया तो it is a very very painful process for her. And we have all have in the center counselors to help them to tide over that grief. They grieve really and tide over that grief, and then they can go for a second chance. Okay, I would put it as not 5 stages of IVF, it is 5 steps, which is essentially जो मैंने आपको शुरू में बताया था. नंबर 1, पेशेंट को एक दफ़ा प्रिपेयर करने के लिए कई दफ़ा हमें 1 month ऑफ ओसी पिल्स भी देना पड़ता है ताकि हार्मोन लेवल सब अच्छे, सबको नहीं देते, कुछ पेशेंट्स को ही देते हैं. सो ओवेरियन स्टिमुलेशन इज स्टेप 1, वेरियन हम लोग पूरा उसको ओवरी को स्टिमुलेट करते हैं. उसके बाद सेकेंड थिंग विल बी हमारा oocyte रिट्रीवल, wherein we try to retrieve the oocyte and take it. Third is fertilization. Fertilization means ये oocyte को sperm से fertilize करके उसमें रखते हैं, लेबोरेटरी में incubators में रखते हैं. That is called as fertilization. That is step 3. उसके बाद step 4 would be in between I forgot, we have to do sperm retrieval also. That is also very important to retrieve the sperm. And sperm retrieval के बाद fertilization and embryo development. अगर embryo एक दफा बन जाए उसका ट्रांसफर करते हैं, that is embryo transfer. ये 5 steps है in IVF. So thank you, and hope you all enjoyed this session. Bye.